Now we're talking about cardiac arrest training for infants. This is a little different. CPR for the infant safety. Remember, this could be a case of shaken baby syndrome or some other type of abuse. It could be a hazardous environment. So as always, let's ensure that the scene is safe as you as the rescuer respond. Now, infants are a little bit different. Their immune systems aren't as developed or strong as us. So if you can at all times, you need to make sure that you're using your personal protective equipment to protect the infant. What I mean by is putting your gloves on before performing CPR. If you have a mask with a one-way valve, you need to use that, or shields so that we can block any bodily fluids. Now, sometimes you'll find, especially in a cardiac arrest, that we may have gasping respirations. This could be agonal breathing. What it would look like is that someone is not breathing normally. They may take a breath, it may look like this. You can clearly see that they're not breathing normal. But when you get on the phone with 911 dispatcher, you may say, yes, I see that the person is breathing because they're in agonal respiration. Or they may be having a seizure, so you say that they're moving. In these cases, though, to the untrained person, this is not responsiveness. This indicates that the infant or whoever were the victim itself could be in trouble. So, in this case, we have quite a large mannequin. We're going to use this for the purposes to assimilate a baby. When you first come up, assume that I have the baby's foot here. You're going to tap the bottom of the baby's foot. Baby, baby, baby. Baby, baby, baby. If you're tapping the bottom of the foot and you're not getting a response, then clearly something's wrong. So now, what you want to do is you want to look to see really quickly if the airway is obstructing, but we can check a pulse even on an infant. If you look, we don't have an arm here, but I can show you on my arm. Between the bicep and the tricep, we have the brachial artery. So what you will do is you will do a 10-second check on the baby's pulse. Don't put a lot of emphasis on this. Maybe you do find a pulse, maybe you don't. If you even can't locate one, assume that there's not one. The baby's unresponsive, that the baby's not breathing. So now we're going to head and continue. Activate our emergency warning system. We're going to contact 911, call EMS, let them know our emergency, render aid, give your name, location. Hi, this is John Smith. I have an infant in his crib. He's unresponsive. He's not breathing. Okay, I'm going to go ahead and administer CPR. You want to give your address, street, town, whatever you can help for that dispatcher. If you have your cell phone and you're speaking to the dispatcher, once you go ahead and start administering CPR, you can lay that phone down and leave it in the open position. They can still hear you talk. So, we're assuming at this point that the baby is unresponsive, the scene's safe, we got our personal protective equipment on, so we'll administer CPR. You're going to take 2 fingers on an infant, okay? You're still going to find the center between the nipples. You're going to place the 2 fingers and you're going to start with 30 chest compressions. It'll look like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now, after this, we're still going to do the chin lift, head tilt, head tilt, chin lift so that we can open up the airway. If you have a one-way valve mask, and if you only have an adult mask, you can use this mask. What you can do is, normally the thinner side of the mask indicates that it goes over the nose. You want to rotate that round, that will fit over the baby's chin. So now we have a complete compression around the chin and the nose. If you don't have that, however, what you can do, if it's a large infant, which is probably not going to be the case, you can still squeeze the nose as you tilt back. But you can also place your mouth over the nose and the mouth of the infant as you give 2 rescue breaths. It'll go like this. You'll cover. You'll give 2 rescue breaths, and then you'll continue again with 30 reps with 2 fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and all the way to 30, and then you'll repeat the 2 rescue breaths. Now, what you'll need to do is you'll need to stay on the phone with EMS until with the 911 dispatcher until EMS arrives. Once EMS arrives, they'll take over. Or in any case, you have someone that responds with an AED or somewhere with a higher medical training than you. But you still must remain with the compressions. As always, even with 2 fingers, your fingers are going to get tired. You're going to need to continue that compression rate. 1/3 the depth of the chest for an infant. You need to make sure that you're staying on point. We're looking for 100 compressions per minute. So, afterwards, we need to make sure that we have done everything that we can to provide good care, especially when it comes to infants. We will remain this, continue until emergency service.